How's it going today? What's that? Yeah, this is the exam. Oh, I'm sorry. That type of exam. I do apologize. Have you already given all of your paperwork to our nurse? Alright, and did he he got copies for you? Okay, yeah, he'll go ahead and make copies for you, and when you get out of here, just ask him, and he'll get those to you. Oh no, we can't give you the original copies. We have to send those in. Yeah. Alright. Now, let's get started. So, what's your name? Okay. And how do you spell that? The last name? Okay. Oh, senior. Oh, congratulations. Alright, and birthday? Alright, very good. Okay then. Now, did you read over the pamphlet, and have you familiarized yourself with all of the legal obligations and... Okay. Okay. Alright, well, just in case, just to go ahead and give you a brief overview, on November 16th, 2012, Colorado passed Amendment 64, allowing the recreational use of cannabis. You can be prescribed it medicinally by a doctor such as myself, or you do not have to have a red card to consume it, but you do have to have a red card and medical permission to actually go into a dispensary and buy medical marijuana. Yeah, it's now enacted as Article 18, Section 16, I believe, of the state constitution. And it's basically for adults 21 and over. It's the personal use and regulation of marijuana, as well as the, commercial cultivation, manufacture, sale, effectively regulating cannabis in a manner to alcohol. So basically what it entails is that you can't do it in public. You have to keep it away from kids. You can't, it is unlike alcohol. You cannot you cannot sell it to other people. But it's decriminalized, it is medicinalized, and it is legalized in the state. Yes. Alright. Oh, no problem. I like to memorize it, or at least get most of it memorized, because I get that a lot. Alright. Now the first thing is your condition. Is there any specific condition that you're coming in here for today? Yeah. Okay. Alright. And how often are you having those headaches? Okay. Now on a level of 1 to 10, 1 being barely noticeable at all, and 10 being extreme agony, how often does it get 7 or above? Okay. And have you consulted another physician about this? Perhaps your family pediatrician, family doctor? Okay. Oh no, I'm familiar with them. Yeah, we actually, we recommend them too. They're kind of on our, we kind of work together on a lot of things. A lot of times, medical marijuana is seen as a alternate to medication. There's a lot of, including a lot of new age beliefs about medicine and doctors. There's also people that just prefer not to take large amounts of medication, and for this reason, cannabis is a very broad spectrum drug. there's literally hundreds of different ailments that it can be used for. So for this reason, a lot of people that are taking many medications for multiple illnesses or multiple symptoms of other medications, they opt to simply use cannabis. And you don't always have to smoke it. I have a lot of patients that they're elderly and they prefer not to smoke it. There's edibles, there's tincture, there's concentrates, there's literally any type of way you can ingest cannabis or the cannabinoids, they sell it. Now for specifics, I would ask your dispensary or your caregiver. They can give you more details about the specific products they offer, because of course one concentrate from one company is going to be much different from another. Not much different, but it could be different from another company. So definitely talk to your caregiver about that if you have any questions about forms of ingesting it. Okay. Oh no, this is, if you're having them this week frequently, this is all that you really need. You can list any additional symptoms, but right now I'm personally going to recommend that you up your plant count to at least 12, and I'm also going to enable you to get up to 4 ounces instead of the standard 2 ounces, because this does seem like a legitimate medical condition that is impeding your lifestyle. Yes, that's correct. This is a medicine. This is something that people take for ailments. Personally, I would recommend, with this, there's actual medical grades. There's cannabis that it doesn't really give the stone body high effect, but it does act as a painkiller, not a painkiller. If you have mild pain, some of the strains that are high in certain cannabinoids can actually assist in relieving that pain. I believe they're called, I believe the acronym is CBD, as opposed to THC, obviously. Oh no, there's about 40 major active cannabinoids in cannabis, but there's over, I believe it's about, oh dear, but I believe it's over about 1,400 different actual cannabinoids that are in cannabis. However, there's only about 40 that are the major ones that are active enough for people to measure, or people to, yeah, you know what I mean. Alright, well, this should do it. I'll go ahead and write up your patient receipt, and what you can do with this is, what you'll do is I'll fill this out. You can hand it to the nurse up front, and what'll happen is you will send what I give you today. You will send a $125 cashier's check or money order, and the address to send all these things to, as well as the envelope have been prepared. Not only that, you will also have to include a proof of residence. Now this is not just your driver's license, as you're from out of state, correct? Well, you just moved here. Okay, do you have a state driver's license yet? Okay, do you have a power bill, any type of utility bill, okay. Okay, okay, great. That's what you gave them? Alright, now what they'll do up front is they'll go ahead and put all of that in the envelope for you. They'll give you a little rundown up front too, but basically all you're going to have to do is you are going to have to purchase your own postage, but just put everything inside of that. We will need to take a copy of your driver's license. Oh yes sir, it's still needed for identification. Even an out-of-state driver's license will be, or is okay. The only thing is, if you had an in-state driver's license, you wouldn't have to send in a proof of residence. Oh yeah, well, it's not particularly a effective bureaucratic system at the moment, but it does work, and they do provide multiple options for getting your red card. So again, I have requested that your plant count be up to 12. You are at, yeah, I got you for 4 ounces instead of the normal 2 ounces. You will have to have a special doctor's recommendation that you'll take in addition to your red card, and for the first 30 days you'll be issued a temporary paper. Now what you're going to do is you're going to go up and you're going to go to the post office. You need to get a registered mail. Basically what's going to happen is you're going to have something to fill out. You're going to send this to the address that's on the envelope, and then when you take it to the post office, the man behind the desk is going to stamp it and then give you the receipt. Now this receipt's important because it shows when you mailed the document off. For 30 days after that, for 30 days after you mail that document off, and 30 days from the date that's on that receipt, then the certified United States Postal Service certified mailing receipt, then what you're going to have to, what you're going to be able to do is, and it's best if you keep it in some type of folder like this. Yeah, the types you use in school are fine too, the 97-cent ones at Walmart. But anyways, you can bring that in there. Make sure that you include your temporary papers, a copy of your identification, as well as keeping identification on you when you go in. It's also wise to keep the utility bills and a copy of anything that you send in, and it's very, very important that you do not forget and do not throw away your certified mailing receipt. If you throw that away, they're not going to be able to tell when you sent it in, and they won't be able to sell you anything. So, up front, you'll be able to find more information, and I do hope that this has been good for you. And actually, one more question. Would you like to sign us over for your caregiver? Oh no, well, yes, this facility is not only a doctor's office, but we also facilitate the actual needs of the patients, meaning that there's a dispensary downstairs. Yes, sir, that is what you've been smelling. Yes, you can smell it from about 500 feet away. Well, anyways, if you want to, you do. Okay, just let them know up front. I'll go ahead and mark that down in here, and I'll put that on your medical card or your medical recommendation. And now what's going to happen is you can just go downstairs, and you are now able to purchase cannabis. Except, actually, I apologize for this. You're actually going to have to go to the post office first and mail this off. It's only 3 o'clock right now. You should be able to make it. So just run to the post office. Make sure you get the mailing receipt, and just come back here. We're open till 7 o'clock. Temporary papers are good through 9 a.m. through to 9 a.m. to 5 p.m. Monday through Friday. You cannot, with a temporary paper, go to dispensaries on Saturday or Sunday or any time other than before 9 a.m. or after 5 p.m. Once you get your permanent red card, you'll be able to go anytime you want. So just go ahead and go off to the post office, bring that back to us, and we'll go ahead and get you set up for your first purchase. Alright, and thank you for coming and seeing us today. And like I said, if you just want, head straight down the hall to your left. That'll be the nurse's station. They'll give you everything you need. They'll give you another rundown on what exactly you need to do. And after that, just go to the post office, and I guess we'll be seeing you back here. And if you get back here today, hopefully before 7. Absolutely, sir. Unfortunately, we can't let you go into the dispensary until you have a valid red card. Unfortunately, it's illegal otherwise. Even though you have your temporaries, and even though I know that I just gave you your temporary papers, it is still technically legal. And the Colorado Medical Marijuana Task Force has cameras and access to said cameras 24 hours a day, so there are very stringent guidelines. Yes, sir. It's for safety, but it's also to make sure this entire thing works, and to make sure that no one takes advantage of it. Alright. Alright, well, it's good to meet you, and I will see you soon. Have a great day. Bye.